Hi, everyone. Welcome to today's Career Chat. I'm Krista Harmon. I'm one of the Career Readiness Consultants with the Kent Intermediate School District in Grand Rapids, Michigan. And I welcome Cassie Kobler. She's a Health Equity Coordinator. I'm so happy to have you here today, Cassie.
Thanks for having me. Excited to be here.
So our half hour is going to go fast, but just to get us started, we're definitely going to dig into what that term means, a Health Equity Coordinator. That sounds like a fascinating job title and one that most of us probably don't know about. But I'd love to take you back to when you were in high school, maybe a sophomore or junior. Were you thinking you'd grow up to be a health equity coordinator, Cassie? Tell us your journey.
Absolutely not. I didn't even know that existed. So I'm originally from Illinois, and senior year was getting ready to look at colleges and figure out what I wanted to do. I was a dual enrollment student. So my senior year of high school, I was at the community college taking some CNA, so some certified nursing assistant courses because I thought I wanted to be a nurse. That was like my mission. I was going to go to school for Spanish and nursing so I could help, maybe double the, amount of folks and do some prevention work. And then I was on that track. I got certified. I was working in a nursing home for a while. I'm like, I don't know if this is for me. I'm not sure if this is really what I want to do or not. So I ended up going to Northern Michigan University all the way up in the UP. They had a fantastic nursing program. They also had a Spanish program as well. Very high tech, high touch up there. And so I was like, okay, maybe this is what I want to do. And after taking organic chemistry and all these other classes, I'm like, I'm not quite sure this is what I want to do. So it was my sophomore year of college, and I ended up changing my major to community health education. So more on like a health promotion, health education route. And I got more involved on campus. I became a resident advisor. So I was responsible for we called them houses. So it was like a floor of students. So it was about 40 students. And I would do a lot of like my programming for my house. So I was doing kind of like a dual, being able to provide my students or my residents with some additional health promotion information. And then I was like, okay, this is kind of what I'd want to be doing. I get this. And I was like, maybe I'll be a health educator in a Spanish speaking community. Maybe that's like a city, maybe that's rural, maybe that's out of this country. And so the day after I graduated from undergrad, literally the day after I graduated, I was on an airplane to Honduras for a study abroad in health education. It was a health education and nursing students went together. And so we kind of partnered up on some projects, but the nursing students went and administered vaccinations and vitamins and well baby checks. And then the health education students, we had implemented some lessons for different grade levels. I'm like, cool, this is great. I came back, I'm like, did I just do what I thought I was going to be working my whole life towards? I was in a Spanish speaking community. I was doing health education, and I was kind of like in a funk. I'm like, is this it? Did I do it? Did I arrive? Is this what I was going to be doing? And then I took a left turn out of public health back into higher education, and I became a hall director. So I was in charge of a whole building of students, so about over 300 students, all undergrad students. And I was kind of trying to figure out what I wanted to do. I love the housing and residence life. I feel like community building was so huge and really helped shape me as a person. Really got me outside of myself and outside of my own comfort zone. So I really liked being a catalyst and like connecting people, like, oh, so-and-so on third floor is really into snowboarding. So I'm going to meet up with him and then introduce the person on the first floor who wants to do that too. So I really loved the community vibe of it. And then I was a full-time grad student during that time as well. I was thinking getting a master's in public health. But we didn't have that program. So I did a master's in public administration. So still like policy, local, state, and government, that kind of education is pretty marketable. It's pretty general to where you can apply it. So I focused on public management, and tried to have a lot of my my thesis and all my work around health policy and promotion. So it was kind of like I had to invent a lot of things along the way. And then I moved to Grand Rapids after that, and have had a few different opportunities in using those skills. But that's kind of my educational journey of how I got some degrees and a whole lot more experience.
Well, I love your story, Cassie, because you're really helping the young people understand that it's not linear. It's not
Nope.
point A to point B, and that you learn things along the way by doing. You know, by being that resident manager, you know, you learned about even your skill sets in coordinating or your interest in coordinating, right? You learned how you're good at connecting people. So just an encouragement to young people, it's by doing some things that you'll start to learn what your skill sets are, what your interests are. So I love that. And I love that you actually had the experience down in Honduras, but you actually were like, I'm not sure. So then you went back into higher ed before, again, kind of evolved. But it sounds like those experiences you had are, again, what helped shape you into doing the things that you do. I love that. So tell us what your job means then when you're a health equity coordinator. And also, as part of it, I'd love to hear what some of those in-between jobs are, because I want young people to understand, like, it still wasn't linear, even at that point with your master's degrees.
Exactly. And that's a huge thing. Like, you can have all these letters behind your name, but it's really the experience and the people that you connect with and the network that you build. And so, my fiance and I, we moved from college after we finished grad school, and we were kind of burnt out. We're like, what do we want to do with our lives? And so we came to Grand Rapids, and I worked a whole slew of part-time jobs, just trying to figure it out. We were new to the area as well. So I worked at the YMCA of Greater Grand Rapids, and worked on some of their nutrition in action work. So if folks are familiar, or if you've seen or heard of the veggie van, I worked closely with the veggie van, and just worked to identify opportunities for folks to eat more fruits and veggies, and kind of do some work around that. And I really got to explore the different neighborhoods and communities that the van served. And then I worked at the Grand Rapids Public Library. I was a library assistant. So when the librarian wasn't there, I was kind of, the next in line for the branch. So I was at the Yankee Clipper branch. And then I also worked at the downtown branch as a reference librarian assistant. So just help people use the different tools, how to use the different programs that the library had for downloading books on audio or Kindles and that kind of thing, really helping people build resumes and use different forms of technology and just find a good read and a good selection and connect with people. And then I worked at this little environmental consulting firm because I was like, hey, this is another aspect of health. This is environmental health. I think, this is important. So I was like really just exploring and learning more. And it was located right next to my apartment. So I'm like, okay, this is kind of cool. Let me just explore this avenue. And then a position at the Kent County Health Department opened up, and it was a program manager for a CDC funded, so the Centers for Disease Control and Prevention was funding a grant, and it's kind of a mouthful. So we called it the REACH grant. It was the Racial and Ethnic Approaches to Community Health. So really looking at culturally appropriate interventions for reducing health disparities. So what that's meaning to say is like working with community to identify some solutions to addressing why there's differences in health outcomes. So specifically, we worked with Hispanic, Latino, or Latina communities, as well as African-American or Black communities, and trying to address health disparities with more of what is called a policy, systems, or environmental changes. So more than just paying for a program or like a wellness walking club. Like we worked with community to identify what routes would work, where would people want to walk, and there's not lighting in this neighborhood, so maybe that's not the safest spot, or the sidewalk's kind of busted up here. but there's a really good park if you go this way. So how do we connect people to assets that are already in their community? And those assets could be churches and parks and playgrounds and all these different things that help shape your health outcomes. And so we worked on tobacco-free living. We worked on healthy eating. So again, we got to work with the veggie van again on this. So that was kind of like a full circle thing for me of being able to work with them as a partner versus as an employee. And we worked with corner store owners. So some neighborhoods don't necessarily have grocery stores right, accessible or really easy to get to. So we worked with the corner store owners and got them set up to be able to sell fruits and veggies from those locations. So folks would be able to have that access. So if they didn't have a car or a reliable transportation, maybe something down the road would be easier for them to snag some healthier foods. And then we worked with different, they call them federally qualified health centers. So those are some health centers that have different benefits and funding to be able to do some community initiatives. So we worked with them to do some non-medical interventions. So not having any like medicine or clinical interventions, but really saying, hey, you've got some pretty high numbers here. You are pre-diabetic. We want to make sure we're watching those numbers. How about you take a walk in your community and you eat some more veggies? Here's a map, a walking route map from your community. And here's a voucher so you can get some fresh produce with the veggie van schedule that I also included. So really doing some wraparound services for community members and really community driven solutions to then make sure that there's like a cultural competency and culturally linguistically appropriate as well. So working with trusted partners in the community that were able to then connect with community to build that trust. So that was like a total game changer. And hopefully by me trying to connect these dots, you can kind of see where that like windy path has led me. So I was at the health department for about 6 years and was able to participate in some facilitation. So I loved doing that when I was an RA. Public speaking is totally fine by me. And so I was able to do a lot of facilitation around health equity and social justice. So those are kind of maybe buzz terms. Maybe you've heard them. It's in my title here now, my new role as a health equity coordinator. But it's really addressing health disparities. And health disparities are differences among groups at the basic level, right? And so really looking at, let's just say vaccine rates, right? Because that's kind of a big thing you may hear in the news all the time. So looking at a certain group, maybe an age group or a racial or ethnic group and seeing where are folks, where are we seeing differences in numbers? Maybe we have one neighborhood in a community that has really high numbers of vaccines. Like they're doing really, really great on getting, whatever the vaccine du jour is, right? Or we see a neighborhood that is not doing great. The zip code is not doing super great. This is maybe the same neighborhood that has really high rates of asthma. Maybe it's a neighborhood that has some other comorbidities or things that are contributing negatively to their health, right? So we look at that and we say, well, why is that? What's going on there? Maybe that neighborhood that has really high rates of vaccines, maybe they have more resources. They have more doctor's offices, or they're close to a park and they're able to walk more. They don't have pollution in their neighborhood as much, right? So kind of looking at some of these root causes and identifying what are some of the systems at play. So maybe it's a transportation system, maybe it's the labor, maybe folks, are trying to get fair wages, maybe it's the education system, all these things that are contributing to someone's health. And it isn't just going to the doctor and not smoking, right? It's all these other pieces that impact your health. And so I left the health department about 4 months ago, and I'm now working at the University of Michigan Health West. So if you might know us as Metro Health. So we're the University of Michigan Health West now, and I am the health equity coordinator, kind of working on those same issues with our patient population.
Well, I love it because it just seems like there's 3 main parts of you that I hear. I hear this person who's really interested in health, and I hear a teacher,
Yeah.
And then I hear this policy person who likes data, right? And so I just want young people to understand that it's not just like one thing fits us. Cassie's a just beautiful example how we can have different parts of us all represented in a job. And I just find it fascinating and so excited that places like University of Michigan West are investing in people like you to really look at issues that haven't been looked at. And that's where people's health outcomes, people in certain, demographics or zip codes die earlier. And so now someone can start to dig into that.
Exactly. Yes.
That's great. So, and I just want to go back just for a little minute. Some of those jobs you mentioned, like the library assistant and the veggie van and the environmental consulting, did you get those jobs through networking? Did you look in the paper or on the online? Like, just give those, like, how are you keeping your eyes open? How did you find those?
Yeah, well, I think there was a lot of need behind that, right? I just moved from maybe a more cushy job, and where I had a community. It was a very humbling experience because I did not have family here. I did not have friends here. I did not go to school here. I did not go to church here, right? And I feel like those are kind of, if you have these networks already, that we may or may not take for granted, right? Where it's like, I am connected, even if I don't necessarily feel that. So I didn't really have any of that. Whereas up north, at college, like I felt like I was I was really well connected and supported. And so coming here, it was really a matter of like, I need to pay the bills. I need to make this move. I need to learn something from this. So I was looking at LinkedIn. I was looking at Indeed jobs. I was trying to make friends at these jobs to say, like, do you have recommendations? So really it was like a lot of vulnerability in that, as well, of just trying to be like, I really want to make it here. This seems like a great place to be. How do I go about doing that? How do I learn more? How do I network? And so I think being an RA, that was really huge, of just trying to go out there, try something new. I was a first generation college student as well. And neither of my parents went to college. So it was a lot of, you don't know what you don't know. So I learned to just ask a lot more questions. I kind of put myself out there, looked at different Facebook groups, and was just looking to see what is going on, and go to different events where they had tables from organizations to just familiarize myself with what was even out there. So I think part of it was necessity to pay the bills and stay afloat. And the other piece was really, I'm a social person too. I like to know what's going on. And so like, how do I stay involved and meet that social need that I have, and learn and potentially use those opportunities to, even if it didn't benefit me at the time, I would know about them. And if I met and made a new friend, I'd be like, oh, you're interested in this. Have you heard of this? And oftentimes they did, because I was new and they were not. But just really being able to share what I know, even, if it's not a direct benefit to me. So really just kind of thinking about how the knowledge that I gather can still connect the dots for other people.
Yeah, I definitely hear a theme as you're talking, that you're definitely a connector and a resource giver. And I just love that your job, you just get to do that. And that's what I want young people to understand. Cassie is very social, as she mentioned. And so doing some of those things may be more comfortable for her personality, but I want you to hear that you have to be taking that action. You have to be the one stepping out. So I just want to encourage those more introverted folks on the call that this is how it works. You have to step outside that comfort zone. Well, thank you for sharing that. I have a question in there. They're kind of wondering what your day-to-day might look like. What are some of your regular job duties? I know it's only been 4 months, but a little bit similar to the health department.
For sure. Yep. So my day-to-day in my current role is, well, now that I work with the hospital, very early meetings, because doctors are either in surgery or meeting with patients, and APPs or advanced physician or advanced providers as well. So really just learning a lot about these new systems that I'm working in. I'm responsible for coming up with the framework that we're going to use to like make, quote unquote, make health equity happen here as like an institutionalized thing. So operationalizing it. How does it show up? How are we increasing access to care, quality, high quality care, culturally and linguistically appropriate care? How are we working with partnerships, and how do we define our partnerships? Are we what is engaging? Are we going to like a health fair? Is that an outreach opportunity? Are we partnering on something where there's some win-wins? What does that look like? And how do we decide that? Thinking of some other things, our systems and procedures, where are our gaps? So I'm really just kind of taking a fine-tooth comb to what we're doing. And then the other piece is, how do we address these root causes? And one of the root causes of a lot of health outcomes is racism, right? So, and just being able to say that out loud and being explicit about that. And it's, could be a very heavy topic. So how do we provide information about that, of historical things and even current practices that could negatively impact the care that is being delivered or follow up? So really kind of connecting more dots here of like, sure, we can provide someone with insulin or prescribe them with insulin, but if they're not able to adhere to the instructions because maybe they weren't able to pay the bills and their electricity's out and they can't keep the insulin in the refrigerator. So how are we working with other partners and other systems to have some more safety nets? So my day-to-day right now is a lot of learning, a lot of puzzle pieces. That's kind of how I envision it. I'm like, put a little piece over here. So I got this section, and then I'm going to start putting some puzzle pieces here. So really just a lot of meetings, and it's a lot of growing and being able to kind of see who our patient base is and where some of those gaps. So it is data. I'm more of a qualitative person. So they're, qualitative or quantitative. I'm more of the story, and give me the details, the narrative. The numbers are great, but there's people behind those numbers. So I like to pull that information out, right? So we can say, this percentage, sure, but there's people behind those data points, and I want to get to that. Like, that's what moves and drives me. So I get to work with all these really smart, phenomenal people that have different skills than me, that I get to either help them along, and they definitely help me along. And so we have a lot of shared opportunities. At the health department, I had a lot of meetings out in community. So really kind of thinking about, because I worked for the whole county. So how do we make sure that we're not just focused on one geographic region? And COVID, honestly, has in a weird way has really opened our eyes to the disparities that were already there, right? We've seen poor health outcomes. They've been there. We know this. And COVID just really put a highlighter through that and shown us where. And so being able to say, yep, if we are the county health department, we need to be all over. And now in my new role, what can we do to, impact our patient base? And then how are we good stewards and good partners at the county level, working with the other health systems too? So really doing a lot of like challenge and support in my role on a day-to-day.
Now, are you the only person doing your role, or do you have a small team you get to work with? Tell me about that.
Yep, I'm the only health equity coordinator, but I do work. So building this framework, I do have a core team. So there's a physician who is a colorectal surgeon, amazing. So I get to learn from her, and who has done a lot of research on health equity and health disparities as well. And she is kind of like my lead physician on this initiative, or this work really. And then there's two other folks that work very closely with us. We're going to be opening that up to having a steering committee, and then some work groups that will be able to be charged with some of this work to move it forward.
That's fantastic. We have less than 5 minutes left, Cassie. I told you it would go so fast.
It really did.
Yeah, I know. So you've certainly talked about the things you love. We hear your passion. That's so exciting. And I love the connections to your personality, your natural skills. Some folks want to know what you don't like about the job. And if you could have known in advance, what would you have liked to know ahead before you got this job?
Yeah. So I think that learning what you don't like is just as important, if not more important, as to what you do love doing. When I was at the health department, I would have some interns as well. So internships are huge, y'all, and especially if you can get them paid. And those are some of my things that I didn't like, right? When we would not be able to do something because of financial constraints. So that's not my experience here in my new role. So that's different. I was fully grant funded in my last role. So that's kind of scary sometimes when your grant is up. So I did not enjoy that always, because then you didn't know if your grant was going to be renewed, if you were going to have to get a different job, if the organization was going to keep you on in a different capacity. So those are some things that I wish I would have known, coming out of college, even the average length of a grant, and how do you work out of a grant into maybe some general funding. My current job, I don't really care for the early morning meetings. I am more of a night owl working on a college campus. More early mornings are not, my best time. So that's something that I'm like, okay, that's definitely something I'm going to have to get a little bit used to, but it could be worse, right?
Absolutely. Yeah, but it's good to know that some young people may not be aware that some jobs are provided, only the funding, like say the money's only there for a short time. All right,
Right.
my last question, and then I'm gonna show the young people a slide that gives them some more resources. Give a plug now. Well, then you get to have a word of wisdom, but I do
Okay.
want you to help them understand the value of job shadowing and internships and some of that as we move to this next slide. Why is that so
Definitely.
important, Cassie?
It's so important because what you learn in the classroom doesn't always reflect what goes on when you're in the quote unquote real world. That's theory, and then you're putting that into practice. And oftentimes, it doesn't completely match up, which is fine. But just knowing that you're not going to have all the answers right away, you're going to be doing a lot of learning on the job, and that's okay. Especially in your first few jobs. And then I think that's why those internships and those shadowing are going to be really important, to be able to get a little taste of that ahead of time.
Yeah, it's so important. Young people, I just want to help you again know about onetonline.org. It's a fantastic government sponsored website about careers, so many great things. I plugged in her title, like health equity, and these are just some of the things that popped up. Some of them you're like, what's a financial quantitative analyst? But if you key down a health informatics specialist, these are job titles you don't know about. Why not get in here and do some research? Health information technologist, these all have suns next to them, which means they're a bright outlook. I just want to show you this kind of tool. When you click on it, it's going to give you what a sample day is like, what kind of education you go, how much money you're going to make. Such a great research tool. Word of wisdom, Cassie. As you've given so many good words of wisdom. And if anyone has a follow-up question, can I pass it on to you if they email me?
Yes, please. Yes.
Okay, so I'm gonna just share my, there's my email, everybody, Krista Harmon at Ken ISD. So if you have a follow-up with Cassie, let me know and I'll be sure to get that to her. And I'm gonna put the sketches link back in the chat for any educators that need to get those sketches, make sure you sign in. But yeah, what do you want to do to sign off these young people?
I think just even in my current role and switching from the health department to this role, I feel like it's very important when you can get to the point of having your values align with your organizations. And when you're not seeing that, then that's okay. And you can start looking, and you can look for something else, and that's okay too.
Yeah. How many years would you say from graduation to now before your official big girl job?
Well, I was probably 23 when I was a hall director. So that was a lot of responsibility for a 23-year-old, but my health department one, I was probably 27.
Yeah. My first big girl job, I was 29. It took a while to do all these parts and pieces. So we're done, Cassie. We'll let you go.
Okay.
Thank you so much.
Okay. Thank you. Bye, everyone.
Okay, bye, everybody. Thanks for coming today.